Well, according to the National Institutes for Health, about 5 million Americans undergo a blood transfusion every year. Transfusions are used to replace blood lost in surgery or accidents and can help people with certain illnesses. Well, for one DeKalb County man, transfusions are a way of life. But as the Fox Medical Team's Beth Galvin tells us, that could soon change.
We hear a lot about the need for blood donors, and Rahul Kapoor is a good example of that. He has a blood disorder and can't produce enough hemoglobin, and that's the protein in our red blood cells that allows them to carry oxygen to the rest of our body. So Kapoor relies on monthly blood transfusions, which is why he's excited about a new gene therapy that might eliminate the need for those transfusions. This is Rahul Kapoor's life. Every month, the Stone Mountain 25-year-old spends up to 6 hours sitting in an armchair here at Emory's Winship Cancer Institute receiving a blood transfusion. And he's been doing this since he was 4.
Without it, I probably wouldn't be here today. So I'm very thankful for it, and all the doctors that have been with me throughout the way, all the nurses, the whole medical staff.
Kapoor has a severe form of the inherited blood disorder beta thalassemia. His body can't produce enough oxygen-carrying red blood cells, so he struggles with severe anemia and fatigue.
Once I get home from work, I'm just headed to the bed. I want to take a 30-minute nap. It ends up being much longer, and I know why.
The monthly treatments keep Kapoor going, but Winship Cancer Institute hematologist Dr. Morgan McLemore says they come with risks.
Individuals can get overloaded with iron and reach toxic levels of iron in their body rather quickly. So they all have to be on medications to keep the iron levels low in their body.
But an experimental gene therapy may put an end to the need for chronic transfusions in patients like Kapoor. Researchers are using a gene-carrying virus to fix the defective gene driving beta thalassemia. 2/3 of the patients who received the treatment were able to stop getting transfusions, and the others sharply cut back on how many they needed with no negative side effects. Rahul Kapoor says he wants to know more about this treatment, but he would jump at the chance to test it out if it might help him put all of this behind him.
I'd be ecstatic. I wouldn't have to take so much time off. I wouldn't have to worry about the risks that I'm still going through by transfusions monthly.
The participants in the study ranged from the age of 12 to 35. There are still some questions about this gene therapy. For example, how long will a treatment last? Will it be safe in children under the age of 12? And can these results in this smaller study be replicated in a much larger group of patients? All of that remains to be seen. For the Fox Medical Team, I'm Beth Galvin.